Hey everybody, Dr. Dane here, and I wanted to tell you about a webinar that I'm doing with my good friend Dr. Joe Tilley, and we're going to be doing this webinar tomorrow, which is the 9th of December. We're going to do it at 10 a.m. Eastern Time. That would be 7 a.m. Pacific Time, and it's actually 3 p.m. in the UK, and it's called Winning in Practice the Wellness Way. And after doing this now for 25 years in my own practice, now 12 years running 8 Weeks to Wellness, what I can tell you, speaking to hundreds if not thousands of chiropractors, is that everybody wants a wellness-based practice. We want to make sure that our patients are not only getting what they need when they come in symptomatically, but we want to make sure that they stay for wellness care, and that would be functional care beyond symptomatic reasons for coming into the practice. And the biggest problem that I see is that most chiropractors don't have a system for being able to create this in their practice. They may have individual pieces of wellness. They may have nutritional consulting they do with their patients, and they may have exercise that they do in or out of the practice, but they don't have a system that ties it all together. And we're going to talk about tomorrow, how do you create that system? Specifically, what do you need to do in your day one, day two process? How do you need to measure wellness? I think this is one of the biggest missing things, is that doctors don't have a specific way to measure function in their patient beyond symptoms. And people need a reason to get care. And once their pain goes away, their reason to continue care goes away along with it. And that's why the patient goes away. But if you have a system to show people why they need to stay beyond symptoms, they will stay and they'll pay for it. So we're going to be covering this. We're going to cover what I consider the three essential and critical elements to a successful wellness-based practice that does this successfully. We'll be talking about that tomorrow. Number one is providing a clear direction for your patients of what the objective and the goal is. Number two is having ample motivation, a reason to inspire people why to do this in the first place. And then the third is having an environment, a supportive environment, where you're literally allowing people to get this done in your practice. Because the fact of the matter is, if they could have done this on their own, they wouldn't need you. So when you create a system and you're able to deliver on the promise, let me tell you, the results speak for themselves and people will continue with your care. So really excited about this webinar. I hope that you can join us, and we will talk to you tomorrow.